Hi, my name is Clay Stamp. I'm your emergency director here in Talbot County. We're now in the first few days of April, and what we're seeing are numbers of cases increasing, not only in New York and New Jersey, but now in Maryland. And so that is expected to continue to rise as we go through April and into May. It's a very tough time for all of us, and your Emergency Operations Center is working day in and day out to support our community in many ways. On today's segment, I'm going to introduce you to Deputy Director Brian LeCates, who's going to take a minute to talk to you about our emergency medical services and some of the things they're going to be doing a little different that we would like for you to know about in the event that you call EMS. So here's Brian. Thank you.
Thanks, Clay. So I'm Brian LeCates, Talbot County Emergency Services Deputy Director and EMS Division Chief. Just wanted to talk to the community for a few minutes about some of the changes that we've seen in EMS and the way we were responding to calls. So when our folks come out to houses or wherever the emergency may be, you'll see us wearing some personal protective equipment, which we would not normally do on all calls, but we have now instituted on every call effective today. So our folks will be wearing masks. They may end up wearing gowns. They always were wearing gloves. But this is to protect our patients as well as our providers. We have a very small workforce, and they're very critical to our emergency services here in the county and being prepared to respond to calls. So we need to protect those folks as well as our patients. So additionally, we are instituting a new protocol where we may leave some of our patients at home if they elect to do so. So folks that we encounter that have minor symptoms of the flu or cold or potentially even COVID-19, if they elected to do so, they have minor symptoms and they have stable vital signs, may stay home, work with their primary care physician, and not go to the hospital. This is really in an effort to not overwhelm the hospital with minor patients that could be better treated in other avenues. So our folks may come out and they would work with the patient and take vital signs and go over a lot of paperwork and leave some information behind. And then if the patient's comfortable with that, then we would leave the scene and leave them there to work with their primary care physicians.
Thank you, Brian. That's really informative for our community to understand what to expect when they call 911 and get EMS to respond to their needs. So this concludes another segment of the community conversation on the coronavirus, and we look forward to talking to you again in the future. Thank you.